The basic unit of every nation is the family, and families can continue to exist when there is procreation. A critical issue regarding procreation, which in many parts of Africa is deemed as a very great issue, is fertility. Fertility issues range from subfertility to infertility to impotence. There are many causes of infertility in women of reproductive ages. Today, we are going to talk about a condition that can render a woman subfertile or infertile. The condition is Asherman'S disease. Asherman'S disease. Now, what we look at today, first, we are going to look at the background information about this patient you are going to talk about. 2, we will look at the patient history and then its explanation. 3, we look at the causes of Asherman'S disease. 4, we look at the symptoms of Asherman'S disease. 5, we look at the diagnosis of Asherman'S disease. 6, we look at linking patient history with a request and then the expected outcome. And then lastly, we look at the prevention of Asherman'S disease. Let's delve right into it. Now let's pick our first objective, that is looking at the background information of the patient. So the patient is a female. The patient is a 34-year-old, and then the history of the patient is Asherman'S disease. Now the radiological request from the doctor is HSG, otherwise known as hysterosalpingography. Now, what condition is Asherman'S disease? And Asherman'S disease is an acquired condition, so it's not something that you are born with. You acquire it. Now, it just refers to having scar tissue in the uterus or at the opening of the uterus. You know, the opening of the uterus is known as the cervix. So it's either you have scar tissue in the uterus itself or you have scar tissue at the opening of the uterus. Now, when there's a presence of scar tissue in the uterus or at the opening of the uterus, it causes the walls of the uterus to thicken. It makes it muscular. And when that happens, it sticks together. So it narrows the pouch, as it were. You know, the uterus is a pouch. It's like a pouch that contains or that harbors a fetus. So when there's scar tissue in the uterus itself or at the cervix, it causes the walls to be thickened, and that causes the size of the uterus to be reduced. Now, Asherman'S disease is also known as intrauterine syncytial or intrauterine adhesions or uterine syncytial. You know, syncytial simply means adhesions. And so intrauterine syncytial means that intra means inside, right? Uterine, uterus. So inside the uterus, it means there's adhesions in the uterus. That's the meaning. So Asherman'S disease can also be referred to as IUA, that is intrauterine adhesions. So which of these terms that you hear anywhere, it still represents the same condition. Now, some research estimates that Asherman'S disease, otherwise known as intrauterine adhesions, happen in nearly 20% of women who have had D and C. Let me deviate a little bit from the discussion and explain something briefly. You know, in the medical field, there are two types of abortion. Okay, there's what we call the medical abortion, and then there's what we call the surgical abortion. Now, with medical abortion, they use drugs to terminate pregnancy. So that is one side of it. Now, when it comes to the surgical abortion, that is where they use surgery to terminate the pregnancy. Now, the surgical abortion is also known as D&C, which is dilation and curettage. So I'm going to stick with just the basic information on it right now. But then the point I want to make is that when someone undergoes D&C, that is when there is a surgical removal of a developing embryo, a fetus, or a baby from the uterus, what happens is that the instrument that I use to chop off, so to speak, to chop off the fetus can chop some of the normal tissues as well. Now, when that happens, when there is a cut, the body's response to cuts, one of it is to develop scar tissue around the area. So it forms scar tissue, and then a new layer of tissue will grow underneath. However, in some situations, in some parts of the human body, when there's a development of a scar tissue, that scar tissue never goes completely. Goes completely. Now, you attest to this fact. Sometimes when you have a cut, it depends on where the cut is found. If it's just on the surface of your skin and it wasn't deep, you realize that when the scar tissue is formed, after a while, you don't really see that there's a cut there. However, you can also have a deep cut, and then the wound will be healed, there will be scar tissue, and then that scar tissue will be there for the rest of your life. So what happens in the uterus during D&C is that when there are cuts, scar tissues can be formed. Now, when these scar tissues are formed, as we explained earlier, it thickens the walls of the uterus. Once it thickens the walls of the uterus, it causes the tissues to stick together. When that happens, it reduces the size of the uterus. So it becomes difficult for a female who has undergone D&C and has developed Asherman's disease to conceive. If unfortunately the scar tissues are the cervix, what it means is that it narrows the cervix. So once the cervix is narrowed, then that causes the difficulty in conceiving. So we have looked at what Asherman's disease is in general. Yes, we understand that one. Now let's look at what causes Asherman's disease. What causes Asherman's disease? Now, there are a number of causes. There are quite a number of causes. I'm just going to mention 5 of them. The principal cause of Asherman's disease is what I explained a few minutes ago. That is development of scar tissue following D&C, following dilation and curettage, following surgical abortion. In fact, according to research, this causes more than 90% of intrauterine adhesions or Asherman's disease. Second is scar tissue after CS or from sutures used to stop hemorrhage. So let's say that a patient was in labor, was unable to deliver naturally, and so they had to do a cesarean section for the person. Now, when sharp objects are used to cut any part of the human body, scar tissue will be formed. That is a fact. So once the patient has undergone cesarean section, there is the likelihood that the scalpel used in the surgery had a cut somewhere, some part of the uterus, or, during cesarean section, it could be that the female was bleeding. So when the female is bleeding too much, they try to stop the hemorrhage. All right. Now, trying to stop the bleeding, there's a likelihood that probably they will use sutures. They will suture the parts. If there's a cut which is resulting in the bleeding, they will try to suture that particular section where there is a cut. So when you suture, still scar tissues will be formed even after the sutures are removed. So when that happens, it still goes back to the condition that the scar tissue causes the walls of the uterus to thicken. Once they thicken, they stick together and they reduce the size of the uterus. Now, the third cause of Asherman's disease or intrauterine adhesions is a condition known as endometriosis. There are 3 types of muscles in the human body. There is what we call the skeletal muscle. There is what we call the cardiac muscle. And then there's what we call the smooth muscle. The skeletal muscles, in fact, are the most abundant muscles in the body. They are found almost everywhere, from our hands to our belly, down to our thighs, to our legs, to our feet, everywhere. Skeletal tissues are found there. Now, we also have the cardiac tissues, which are more specific. These ones are found in the heart. So the heart muscles are the cardiac muscles. Then we have the smooth muscles. They are located, or they are found in the GIT, otherwise known as the gastrointestinal tract. So they are found there, as well as the uterus. So the type of muscle that are found in the uterus are smooth muscles, and there are unique muscles. What happens is that these tissues which come together to form these muscles can grow outside the uterus. So the specific type of muscle which is found in the uterus, you can have these tissues forming outside the uterus. When that happens, we term it as endometriosis. So when this happens, it can also cause Asherman's disease. Now, the fourth cause of Asherman's disease is infections of the reproductive organs. So if you've had urinary tract infections, UTI, or you've had sexually transmitted infections, STIs, these ones can still cause Asherman's disease. It can cause a reduction in size of the uterus. Then the last condition is radiation treatment. Radiation is one of the things that can give mixed feelings. Let me put it that way, in the sense that it can be used to cure diseases. At the same time, it can cause diseases. All right. So radiation treatment can also cause. In fact, it can cause burns. So once there are burns, there will be scar tissue formed, and then things like that. So primarily, when a patient comes with a cervical cancer, the treatment regimen is chemotherapy, radiation therapy, and then maybe surgery. So when the patient undergoes radiation therapy, it could be that the radiation caused burns to parts of the uterus. And when that happens, scar tissue will be formed, and then the condition comes back as Asherman's disease. Now, how do we know that one has Asherman's disease? That brings us to the fourth objective, which is the symptoms of Asherman's disease, the symptoms. So I outlined 4 symptoms over here. First symptom is that the patient or the person or the individual will present with light, in fact, very light periods, a condition known as hypomenorrhea. So the person's monthly cycle, the period is very light. I mean, the bladder comes out is very, very, very light. When you have a condition like that, it does not necessarily mean you have Asherman's disease, but it could be a clinical indication of Asherman's disease. So you just have to go see your doctor, probably your gynecologist, and then ask more questions to get clarification. Second symptom is that you can also have no periods at all, no period. So you can have very light periods, and you can also have no periods at all. This condition is known as amenorrhea. Now, the third symptom of Asherman's disease is severe cramping or pain during menses. It could happen during menses, or it could happen anytime during the menstrual cycle. So when you are always feeling severe cramping, when you are always feeling that kind of sharp pain during your period, it could be an indication of Asherman's disease. Now, the fourth symptom is being unable to get pregnant. I mean, the obvious reason. So once the uterus gets, the size of the uterus get reduced, or probably the opening, the surface of the uterus is now narrowed, your chances of getting pregnant is very, very low. So fertility issues can also be a symptom of Asherman's disease. And in fact, it is for which reason the patient we are discussing was asked to go in for the hysterosalpingography, that radiological request. Now, we must also note that not everyone having Asherman's disease will have symptoms. So some have no symptoms at all. Others have normal periods. So you can have your normal period and yet you still have Asherman's disease. So the bottom line, just be going for medical checkup regularly. I mean, that's it. And the very fact that you're having a normal period doesn't mean always you have normal period at the end of every month or during the month. Doesn't mean that everything is fine. I mean, just check it out and see if indeed everything is fine. Now, let's look at our next objective. So the fifth objective is diagnosing Asherman's disease. So how do we diagnose Asherman's disease? So one thing that will be done once you get to the hospital, you go see your doctor, you explain all the things you're feeling and all of that. One thing they do is physical examination. So they physically examine you. However, the only problem here is that adhesions cannot be found during this process. So if indeed you have Asherman's disease, physical examination will not be able to tell that there are adhesions like that. 2, they can also request for a hormone test. Now, this hormone test is done to rule out endocrine problems. They want to make sure that the issue we have has nothing to do with hormones. Menstrual periods and all those things surrounding fertility are all linked with hormones. They all happen under the influence of hormones. So they want to rule out if there are no issues with hormones. Or they might even use hormones to induce bleeding. So in cases where you have amenorrhea or you have hypomenorrhea, so when you have no periods to very light periods, they can use hormone treatment or hormone tests to induce bleeding. Now, the third way they can also diagnose it is by a test known as SIS, otherwise known as saline infusion sonography. This particular test is also known as hysterosonography. So, sono means sound, hystero means uterus. In fact, the medical term for the uterus is hyster, as you can see from the screen. So, it means that they are using sound to examine the uterus. So, here they use ultrasound to examine the uterus to find out if the size of the uterus is small and things like that. They can use that one to determine. Now, the point of emphasis and where I'm so much interested in is the very last way they diagnose Asherman's disease, which is HSG. We will stay on this for a while. So HSG, otherwise known as hysterosalpingography. So I've already explained that the medical term for the uterus is hyster. All right. Majority of these medical terms come from Greek and Latin roots, and so their pronunciations are a little bit some way, but it is what it is, right? So the uterus is the hyster, the salpings are the fallopian tubes, and then the graphy is the examination. So when we say hysterosalpingography, we're just saying that we are going to examine the uterus and the fallopian tubes together. So the examination of the uterus and the fallopian tubes, that is the condition or the examination we call hysterosalpingography. So now in this case, what happens is that this examination is done under fluoroscopy. Now, fluoroscopy is a type of imaging modality. In my introductory video, I explained some of these modalities that are used in the field of radiography. So I said, and I will repeat, that fluoroscopy here, you are taking images. However, it's in the form of a video. So you are seeing the body part in real time. Okay, so as you expose the body part to radiation, you can see. So you can move your X-ray tube. I'll explain that later on. You can move your X-ray tube around, and once it is moving, you will still be seeing the parts of the body where it is being exposed to radiation on the screen. You will see all of that on the screen. So it's like a video that will be showing. So what happens here is that contrast, as I mentioned here, is a chemical. Now, this chemical is used to enhance the opacity of a body part for visualization purposes. So the radiologists will introduce what we call contrast through the cervix of the vagina into the uterus. All right. Now, when this is done, what the radiologist is looking for is narrowing, is filling defects. He's also looking out for blockage. He's looking out for growth. So these are things that the radiologist will be looking for when the patient is undergoing this fluoroscopic examination. So if there are adhesions, that it will be shown. The radiologist can see. If there are growth, the radiologist can see. If there are blockages somewhere, the radiologist can see. So once you're able to detect that there's a blockage somewhere, then you have found the root cause of the problem. Then you can go into treatment. Now, I'm not going to look at the treatment of Asherman's disease because it's out of scope. Yes, the purpose of this discussion has nothing to do with the treatment. So we're looking at the causes, we're looking at the symptoms, we look at how we relate the patient history with the examination and why it was requested. And then we also look out for the prevention. Very important. The prevention, they say, is better than cure. So we have seen So this patient came in with Asherman's disease. So you'll be there. Probably you're at your facility, and then a request form comes to you. If you're a radiographer, I'm speaking to you. If the request form comes to you and you see Asherman's disease, you see intrauterine adhesions, you see intrauterine syndicate, they all mean the same thing. It's just a medical condition, and it's just characterized by the formation of scar tissue in the uterus or at the cervix of the uterus. Yeah, so if you are a nurse, if you're a student, if you see any medical examination somewhere, you see any form, and then it is written Asherman's disease, that is just the explanation. All right, so that you'll be able to understand what is happening. Probably your sister or maybe a family member might have gone to the hospital, and then a request like that might have been given her. Of course, males cannot develop Asherman's disease. They don't have uterus, so definitely it's going to be a female. So once a female goes to the hospital, and then it is queried that there's a likelihood the person has Asherman's disease following infertility issues, and then that could be an indication. So you now get it now. How do we prevent Asherman's disease? The prevention of Asherman's disease, if you really paid attention to the video, have all been stated. Yeah. So the best way to prevent Asherman's disease is not to do the things that cause Asherman's disease. I mean, this is just simple, right? So we have seen that when you undergo D&C, complications of medical abortion, we follow it up with surgery to completely terminate it, you can develop Asherman's disease, right, later on. So therefore, then the obvious thing is that you try to avoid such a scenario. Then we have also seen that scar tissue can also develop after CS, after cesarean sections. So this one you may not have control over, because sometimes the circumstances will demand that indeed you undergo CS. If not, you may not be able to deliver, or even the baby and the child may die out in the process. All right, so this you basically have no control over. However, the ones you have control over, like treatment of infections, when you have STI, when you have UTI, make sure you treat them. Don't get used to buying drugs from over-the-counter medicine sellers. I mean, it's not advisable. Make sure you always get a medical doctor's prescription or a pharmacist's prescription before you take any drug to treat any infection. You know, antibiotics are not supposed to be taken for a long time. People do not know, and then every little infection they have, they just walk into an over-the-counter medical store and then they just pick anything. I mean, it's not the best. So we look at these things. So if you want to prevent Asherman's disease, this is what we do. Thank you very much for enjoying this session. I know you really enjoyed this session. So thank you very much. But don't forget to subscribe. Okay? The subscribe button is just down below this video. So just subscribe, please. Subscribe. And then share it with your friends. Share it with your colleagues. I mean, share it with everyone. You can even share it on your social media handles for me. I'll be very, very grateful. Thank you very much for this session. So this is the very first lesson in the request form series. Now the next video will be released on Wednesday. So please turn on your notification and turn it on, so that as soon as I release that video on Wednesday, you're going to see it, and it will be the first to watch. It's going to be a very interesting video. It's a general knowledge in radiography. So we will look at that one. So have a good day wherever you are. And then my name is Daniel Jima, and I am your diagnostic radiographer on YouTube. Peace out.